In this lecture, we'll be discussing growing into professional competence. Now, we know that as mental health professionals, we're expected to be competent. We should possess certain knowledge, we should be able to perform certain clinical skills, and we should only use interventions that we're trained to use. When using those interventions, we're also expected to have a certain degree of proficiency with using them. But is that all competence is? Is it simply meeting the minimum standards of your field? Once you finish your grad school program in good standing, does that mean you're competent? Are you competent after you pass your state's licensure exams? And once you have achieved competence, is that something you carry with you always? Once you achieved it, is it something that you can then not worry about anymore? On closer examination, we find several things to be true about competence. First of all, yes, it is a demonstration of certain skills. In order to be a competent mental health professional, there are certain things you have to be able to do, certain skills you have to be able to implement, and a certain skill level with which you have to be able to implement those things. But competence is also a psychological need. As a mental health professional, you're going to want to feel competent in your field. You're going to want to have that confidence and that sense of self-efficacy that you're able to perform the task of your field at a high enough level to satisfy yourself. Competence is always under construction. So no, it's not something that once achieved, you no longer have to worry about. You'll always be working toward a higher level of competence and working to maintain the competence that you've already achieved. This is a commitment to personal and professional excellence. So as we keep talking about, the field of mental health is about working on you as a person as well as your professional skills. So it's a commitment to excelling personally and professionally. And this requires a great deal of self-awareness and self-exploration. And finally, competence is not self-defined. So you cannot determine that you are competent. So who defines your competence? It's going to be through the feedback that you receive in your graduate courses, the feedback that you receive from your supervised experiences like practicum or internship. It's going to be your performance on your licensure exams. So these are going to be the things that define your level of competence. And so once you've achieved competence, how do you maintain it? Through things like continuing education. So each year you're going to be required to obtain a certain number of hours of continued education in order to maintain and improve your competence. You can attend professional conferences. You can read journals. You can get supervision from somebody who is more skilled in a particular area you may be trying to develop skills in, consultation with your peers, and also personal therapy.